Ma'am, we are live, ma'am. We can start.
Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Quiz, organized by Fever Foundation. Welcome to all of you. Before we start, I just briefly give you about Fever Foundation and its activity. Fever Foundation is an independent and non-commercial foundation supporting the educational and academic activities to address the unmet needs in fever management. This foundation is committed to conceive, build, and sustain programs and make scientific initiatives which are providing evidence based updates to healthcare professionals. The vision of Fever Foundation is to strive towards imparting knowledge on the unmet needs and provide transform information on research, education, and therapy updates on fever management. So activities of Fever Foundation includes we conduct annual fever conference every year in November. Fever conference happen. It's called as FEFCON. We've completed 6 years of conference. This year 2024 is the seventh year annual fever conference. We conduct throughout the year fever CMEs for pediatricians, physicians, and general practitioners and our family physicians. We bring about book on fever management. Every year we bring about two books on fever management. Till now, we have brought about more than 13 books on fever management because in COVID time, we brought a separate book on fever in COVID time. Then clinical and epidemiological research, we have started this and this year original research activity has begun. Then challenging case presentation competition for PGs, Young Scholar Awards, patient education, paramedical education, public awareness and parent education activity is also conducted. This year we had some special activities such as Fever Week. But between 24th to 30th May, it was done first time in India and first time in the world. Fever Week was conducted. This was commemorating the birth anniversary of Sir Gabriel Fahrenheit, who invented the thermometer and Fahrenheit scale. So we celebrated that week, 24th to 30th. During that week, we had a lot of scientific activity. We have national mega webinar on panel discussion on errors in the management of fever. 24th May was pediatricians, 25th May for physicians. And we also conducted CME across India during that week. More than 100 programs were planned and was executed during Fever Week. And patient and public educational activities were done. Our advisory board members were kind enough to take up this activity, and all the patient and public awareness activity in different, all the regional languages was done through FM radio. This year, we started fever research activity initiation. The first original research activity has been initiated at LN Medical College, Bhopal. And fever quiz, for postgraduate is an active activity which happens to Fever Foundation for the past 6 years. We have zonal quizzes this year, 23rd, 24th, 25th, 26th. And pediatric nutrition speed happens at 4 o'clock. Intern medicine happens at 7 o'clock. And the winners of this zonal quiz will be eligible for competing for the national quiz competition. They will be attending this national FEFCON, wherein they will be competing for the national championship, which is going to be held in November. We do have poster presentation competition for postgraduate, both in medicine and the pediatrics. Please note the last date for submitting your poster is 10th of September. All the details will be sent to your department and HODs, and it will be notified in your notice board as well. And also, you will get the emails because we have the register email of all of you. And secondly, please note that these posters have to be related to fever only. It could be fever case or original research, but it has to be related to fever. Poster presentation competition will be held on 17th and 18th of October 2024 before the FEFCON starts. And all your posters, the selected posters by our jury, will be displayed during FEFCON. Then we have also developed fever training module where it's a certificate course for general practitioner and family physicians on the fever management. So this occasion, I take this opportunity to welcome you all to FEFCON 2024, which is a seventh annual national conference of Fever Foundation of India. It is going to be held on 23rd and 24th of November 2024. So today's quiz, we have a privilege and pleasure to have with us Dr. Jagdish Chinnappa sir as our quiz host. He's a consultant cluster head at Pediatrics, Manipal Hospital, Manipal Group of Hospital, Bangalore. and he is the past president of Respiratory Chapter, Indian Academy of Pediatrics, 19 to 21. He is the CEO of Bangalore Medtrain LLP, consultant Child Central Bangalore. So, Dr. Jagdish Channappa, sir, it's a pleasure and the privilege to have you with us. And sir has been the founder member of Fever Foundation, supporting all the scientific activities. So we have with us Professor Dr. Sukumaran sir. Sir is former professor and head of the Department of Pediatric at PIMS Tiruvalla, past president of IAP, national president of IAP Respiratory Chapter, national president of Allergy and Immunology Chapter, best doctor award from Government of Kerala, and professor of pediatrics in various government medical college and had written several books and edited many books. Sir is also our founder member. He is also supporting with all the scientific activities under FIVO Foundation. So, Professor Kumaran sir, welcome to you, sir. We have another quiz master today, Dr. Anand Keshavan sir. Sir is a professor of pediatric at TMC Thrissur. He's IAP National Vice President 2020, if I may say so. Sir is the contesting for the president post this year, and past National President IAP Neurology Chapter, past President and Secretary of IAP Kerala, Editorial in Chief in Indian Journal of Trauma and Emergency, Chief Editor of IAP TB Pediatric Radiology, Frontier in Pediatrics Neurology, Recent Advances Neonatology, and Sir is also founder member of National Advisory Board of Indian Pediatrics, and also is founder member of our Fever Foundation. Sir is also into a lot of educational and teaching his passion. So he is with his busy schedule. He is still there with us, helping us in conducting the quiz. So thank you very much, Sir Anna Keshavan, sir, for joining in. We have another quiz master from Rajkot, sir, Dr. Agnesh Paput, sir is the director of Om Baby Care Hospital, Rajkot. He's a chairperson of IAP ID Chapter 2021, EB Central IAP 2099 and 2030, president of AOP Gujarat. He has several special achievements, awards, and publication. I'm just condensing it. He's editor of the coffee book table book on vaccine and vaccinology. He has several publications and also chapters in various books like IAP ID book. He has been the part of protocols on various common pediatric disorders. He's written articles in IP and IJPP journals. And he has organized many national and state level events. He's been known for his organizing capacity. Sir is also founder member of Fever Foundation, and he's been helping us with CME activity, quiz, poster competition, lot of the scientific activities with us. So, Dr. Yagnesh Popat, sir, thank you very much for joining us as quiz master today, sir. Welcome to you. So we have with us the jury of today, Dr. M.K. Sudarshan, sir. Sir will be the jury for today's quiz. Sir is a member of our Fever Foundation Advisory Board, national member, founder member, ex-director and retired dean, principal, professor and HOD of community medicine at Kempegowda Institute of Medical Sciences, Bangalore. He is a chairman of state COVID-19 technical advisory committee of Government of Karnataka from 20 to 2023, chairman of World Health Organization Southeast Asian region for Rabies Technical Advisory Group in New Delhi. He is also a member of National Technical Advisory Group of Rabies. He is a NABH Principal Assessor for All Ethics Committee and Clinical Trials in Delhi. He is also a member of WHO Rabies Expert Committee and Consultation, WHO, Gavi, etc. And he is also advisor for rabies of Government of India till date. And sir has a huge research activity and publications, and he has expert committee for research in Rajiv Gandhi Health University of Government of Karnataka. He's advisor also to Public Health of Indian Institute of Science. He's a recipient of several awards and accolades, including the highest award of Karnataka government, Rajyotsava State University. And please note, he is also a recipient of honorary doctorate in SES, DSC, from our Rajiv Gandhi Health University, and he has more than 100 research publication in rabies and others. Sir, Dr. M.K. Sudarshan, sir, it's a pleasure and privilege to have you with us as the jury for today's quiz, sir. Before we start the quiz, and welcome to all our quiz masters, host, and the jury, and all the participants, I would like to tell the participants certain rules and regulations of this fever quiz. Number one, this quiz is for the postgraduates only. The quiz consists of multiple choice questionnaire. There is 15 seconds to answer each question. The option to be selected by clicking on the button on the text panel. Please note the video display with option will only for representation purpose only. You cannot click on the video to submit your answer. Please click on the option which is below this video, the text panel where the options are ABCD is there. You select your option and click on the button to submit. The participants are advised not to leave the platform. Once the answer is submitted, it will not be possible to revert. There is no negative marking in the quiz. The winner will be the maximum fastest right answer. See, if there is a tiebreaker round will be done to decide the winner, and it is advisable to use the laptop and desktop. You should not use mobile phones for getting answers from your colleagues sitting nearby. The Fever Foundation is not responsible for any form of technical error, such as poor net connectivity. Then participation in the quiz implies that the participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participants in quiz and the candidacy of the prize. And first and second winner from each zone will enter the national level quiz competition, which is going to be FEFCON 2024, which is scheduled in November 2024. The quiz masters and judges decision will be final, and all of us are abide by this. So it's these are the rules, and once again wishing you all for best of luck for this fever quiz. Now I hand over the session to our quiz host, Dr. Jagdish Channappa sir. Sir, you are on
Thank
mute,
you
sir.
very much, Dr.
Yeah.
Manjula. You hear me now? Yeah. Okay.
Yes.
So we are on the third day of this quiz, and today is going to be the West Zone. We have a very exciting quiz master, Dr. Yagnesh Popat, and we have Dr. Sukumaran and Dr. Anand Keshavan also joining in. And we are going to have a wonderful time to look at all the quiz questions. And to see that this quiz is run properly, we have Dr. Sudarshan, who will be the taskmaster if anything is not according to his strict guidelines. So this quiz will start shortly, and I wish all of you all the best for this quiz.
Over to Sukumaran sir.
Yeah, I will take.
Yeah,
So,
Dr. Yagnesh sir.
Take this
Yes,
will
sir.
take.
Yes, sir. Please go over to you, sir.
Good afternoon, all. I'm very happy to share the screen with my colleague for the quiz master today, Dr. Sukumaran sir, experts for the day, Dr. Jagdish Chennapaji and Dr. Keshavan, and jury, Dr. Sudarshan sir, along with the micro team led by Dr. Manjula. Friends, today we are conducting a third round of the quiz. Today's quiz is meant for the west zone of the India, and the as Madam has already enumerated, first and second winner will be the finalist for the national FF Con quiz to be conducted in November. The details of that will be communicated individually to the winners later. So friends, with this short introduction, I think you all must be ready with your laptops, ready to answer. And I know you all are bubbling with the enthusiasm to participate in the quiz and showcase your excellent knowledge that you have gathered over years along with your colleagues in the medical college. So we will start. The quiz rules has been already enumerated. I will not go in detail of the rules against, but we will start the quiz. Computer ji, can we start the quiz now? So, rules and regulation have already been enumerated. I will not go in again detail. If anybody has a question that we can answer in the chat box. First round will be the dummy round. Demo questions we will be conducting so that all of you are well versed with the process of answering. Yeah, first question. This is a demo question only. Who is the first Prime Minister of India? A. Indira Gandhi, B. Narendra Modi, C. Jawaharlal Nehru, D. Rajiv Gandhi. Your time starts now. You have 15 seconds. Yes, till our computer J is ready with the graph, I'm sure nobody would have given the answer B to this answer, not even for the purpose of the demo.
It's a right answer, you can ask, sir.
Yeah. But madam, the thing is that our general knowledge for our postgraduates are less now. They
Yeah.
are mainly interested in pediatrics.
At least not
That-
with regards to this quiz. But of course, Narendra Modi ji is so much in the news that everybody remembers only one prime minister and nobody else. So there is always a chance to misinterpret. Anyway,
This should be 100%, 100%. Yes. So the answer. Then
Correct answer.
so computer ji, are you ready with the graph?
No,
Oh,
first
correct
ask
answer.
correct
Answer.
answer.
Correct.
Correct
Yeah.
answer.
Oh, that is
Oh, that is-
90%. Even 10% are wrong. Great. They must, I'm sure they are not wrong by the value of knowledge, but they must have tried the whether we are entering the wrong answers or not. That is, they want to check. So that is why they must have given the other answer. So the right answer is, of course, the C, Dr. Jawaharlal Nehru is the right answer. So next question. And the Divyanshi Patel from the Pramukh Swami Medical College, Gujarat, is the winner for the fastest answer to this question. Answer has been clicked in 5 seconds. I think this is the huge time. I was expecting 1 second only, but still the correct answer is 5 seconds. Next demo question again, computer ji, or
Yeah, sir. 3 demo questions will be there.
3 demo questions. Yeah.
Yeah, for them to
So the
familiarize.
next question is, which is the capital of India? New Delhi, Mumbai, Chennai, or Kolkata? Your time starts now. Time's up. So, of course, here is also the clear answer. Here, the organizers should have kept the two options of New Delhi and Delhi. Only then it would have been issue with regards to the whether to identify Delhi or as a capital or New Delhi as a capital. Otherwise, this is again a simple question with a simple answer. I'm sure again 100% would be the correct answer. So this is the correct answer, and the computer will shortly display the graph of how many of you have. Yes, 100%. You are right.
100%.
These are well-read preges. The third now demo question will go for a third demo question. But before that, the Nili Mehta, again Pramukh Swami Medical College, answered in 2 seconds. Right, that is now better than the previous, even better than the previous one. Third demo question again. Who is Sachin Tendulkar? Indian hockey player, Indian kabaddi player, Indian cricketer, or Indian marathon runner? Your time starts now. I think somebody may think here that the Sachin Tendulkar plays so much of cricket, he runs so much, so he can be even labeled as Indian marathon runner. But let us see what the answer that our jury has approved is Indian cricketer. So this correct answer is, of course, Indian cricketer, and computer jury G is ready with the graph. Shortly they will display the graph, and let us see how many of you have correctly answered and how fast it is. It is also equally important not only to give a correct answer, but to give it fastest only then your name will be displayed.
Oh, good,
So
good.
100% of course is the correct answer, Indian cricketer. And let us see the fastest answer. Again, Naresh Dedi from the Pramukh Swami Medical College within 2 seconds. I think computer ji check whether nobody else other than the Pramukh Swami Medical College has joined. All
Yeah.
participants are from the same college, or there are few more participants from the other colleges
more than
also?
nearly 40 students are playing this, so I don't think they're all from same college also.
That's great.
What's the situated in this medical college? Which space?
Karamsad is a city near Anand, where Dr. Somsekhar is the head of the department.
Somsekhar Nilambangar.
Somsekhar Nimbarkar. So I think now you all are well versed with the process of quiz, how it is being conducted, and we can start the actual quiz now. So computer ji, now we will start the actual quiz and your answers will be recorded. So first question to your quiz is on your screen. Which of the following is not a red flag sign in child presenting in the emergency room? Not a red flag sign. Remember, A, capillary refill time, which is more than 3 seconds, dull and lethargic child, irritable and crying child, diffuse macular rashes. Out of this, which is the correct answer? Your time starts now. Then in emergency room, when child presents, the first thing you will look is at the capillary refill time. If it is more, it indicates a circulatory failure. Dull lethargic child indicates a failure to CNS, and irritable and crying child against is uncomfortable child with diffuse macular rashes that indicates a various virus infection. Let us see what is the correct answer. So diffuse macular rash is just an indication that the child is suffering from a viral infection, but it is not a red flag sign because it is there in many of the virus condition. And many of the time it is pathognomic of that particular virus so that you can identify which viral infection is child is suffering from. So the correct answer here is diffuse macular sign is not a red flag sign for a child presenting in emergency room. So let us see how many of you have given a correct answer. 62% has given a correct answer. Again, few of them are lagging behind. Friends, remember this is not just a demo question. You should be very particular and fast in your answers. Let us see who has given the fastest answer. Vijay Aruge from the Indira Gandhi Government Medical College, Nagpur, Maharashtra. Great, only 1 second. Excellent. So she must be waiting for her perfect turn and not utilizing her energy in the demo questions must be the reason why her name was not featured in previous demo questions. Congratulations to the Dr. Vijay Aruge for an excellent fast answer. Competition, next question. Which of the following is not a clinical sign or symptom of a viral illness? Number 1, more than 2 mucous membranes involved. 2, dysentery. Similar illnesses in all family members, illnesses representing by running nose or coryza, or vesicles on the hard palate. Your time starts now. Friends, this is another easy question for you. When you are differentiating between the viral fever and the bacterial fever, the first point that is there in the differentiation is similar illnesses in the all other family members. So surrounding also as well as in the same family. If there are other children of the almost same age group, they are most commonly affected. So similar illness in the all other family members including the running nose and coryza is the almost pathognomonic sign of the viral illness. Second, more than 2 mucous membranes are involved. This is another sign which is very pathognomic of the viral fever. Vesicles on the hard palate, pathognomic of the various viral infection, including the hand, foot, and mouth disease, and the dysentery. The fourth one, dysentery probably is the condition which is characterized by the macroscopic blood. It's not the microscopic blood in the stool, but it is macroscopic blood in the stool. And it is, of course, not pathognomic of the viral fever. Computer Ji, what is the right answer?
So the right answer.
Nahin. Right answer.
The right
Computer
answer
Ji?
is again dysentery. I think
Yeah.
the more important thing is that one more points are there. Few more points are there. In those children we are having a viral disease, you must look the condition of the child in the interfebrile period. If the child is perfectly all right, all right in between the interfebrile period, most will be viral. But in a bacterial infection, child will be sick in the interfebrile period. That is very, very important. As you all know, dysentery is produced by mainly Shigella. It's a bacterial infection. Okay, the correct
Another
answer is dysentery.
pathognomic condition or pathognomic symptom of the viral infection is the high-grade fever. Usually, the fever intensity is very high in the early stage of the disease during viral fever against bacterial, where it is gradually increasing. And the third, fourth day, there will be a high-grade fever. This is another manifestation of the viral fever. Now, Computer Ji, let us have a graph. Yes, 79% of the participant has given a correct answer, that is dysentery B. And who is the fastest? Vedanti Balati, again from the Indira Gandhi Government Medical College.
2 seconds.
I think, can you move to the next one, sir?
Yeah.
Sukumaran, sir, you can take over. Sir, internet issue, I think.
Okay.
Yagnesh,
I
sir.
will take up.
Yeah, sir is back. Yagnesh, sir, can you hear us?
Yeah, I can hear, just my screen
Yeah,
is being red.
yeah.
Doesn't matter,
Yes.
Dr. Sukaman, take the third one by the time I
Okay.
am again.
Okay, coming to the third question. Which of the following investigations are a part of sepsis screening? A is conventional ESR, B is procalcitonin, C is peripheral blood smear, and D is CRP. Your time starts now. So the correct answer. So the correct answer is CRP protein. Even though all other investigations help in the diagnosis of sepsis, conventional ESR, the most important in newborn is a micro ESR. Procalcitonin is a very sensitive index than CRP, but it is very costly, and so it cannot be taken as a screening test. Peripheral smear may also help, but the classical investigation, which helps to suspect sepsis or screen sepsis, is CRP. Show the graph now. So the correct answer is D. Please show the graph now.
Takes about 20 seconds.
Okay. The thing is that in the peripheral smear also, one can look for leukocytosis, neutrophilia can be the, look for the band forms. You can take the ratio of immature to mature forms of neutrophils, which will be elevated. And the correct answer is given by
76%. Great.
76%. 76%. Who is the winner? Oh, is Nili Mehta. She has taken only 1 second. 1 second. Congratulations, Dr. Nili Mehta. Congratulations. Then we will go to the next question.
Yeah. Question 4. Which of the following is an intravenous drug of choice as per ICMR AMR data for the child with enteric fever admitted to the ward? It is not OPD-based treatment, indoor treatment. A. Ceftriaxone or ceftriaxone. B. Cotrimazole. C. Azithromycin. D. Ciprofloxacin. And E. Meropenem. Your time starts now. Friends, these antibiotics have been used for management of enteric fever in hospitalized patients. But remember, still in India, as far as India is concerned, ceftriaxone sensitivity is excellent, except for the few pockets somewhere, of course, in somewhere in Gujarat as well as a part of Delhi, where some pockets of resistance has been noted. Otherwise, ceftriaxone is even at today, the first drug of choice as far as the enteric fever in the hospitalized patient is concerned. So to my opinion, the ceftriaxone should be the right answer. Cotrimazole can be used for OPD patients, not routinely, not for the indoor patients. So
I think the main indication for azithromycin now is for extremely resistant staphylococcal, extremely resistant infections, enteric fever. That is mainly reported from Pakistan. So it is a drug of choice for extremely resistant enteric fever. Okay.
The correct answer is ceftriaxone. I congratulate all those who had given a correct answer. Let us see the graph by Computer G. Yes, 65% of the participant has given a correct answer, which is ceftriaxone. All those who are in favor of meropenem and the ciprofloxacin, please do not use it as a first line. Use only ceftriaxone. Till today, even ceftriaxone is the first drug of choice for enteric fever. Let us see who is the fastest one. Nili Mehta, again from the Pramukh Swami Medical College, responded within 2 seconds. Excellent, Nili. Congratulations. Now we move on to the next question. What is the Centaur score? A. Scoring system for critically ill children in emergency room. Scoring system for acute bacterial pharyngitis. Scoring system to predict leptospirosis. Scoring system to predict mortality in ICU patient. Your time starts now. Dr. Jagdish sir, your comments on the Centaur score.
I think the Centaur score is a very useful score to predict whether it is a viral induced upper respiratory infection with tonsillar involvement or a pure bacterial tonsillitis. So I think the Centaur score will gauge whether it is a localized infection or otherwise. Basically, there should be absence of cough, there should be tender lymphadenopathy, there should be hyperemia in the tonsil, and it should be localized to only the tonsil and the pharyngeal area. and should be accompanied with an acute fever. So the Centaur score is a very useful score. There are other scores which are available also, but this is the one which is used for diagnosing tonsillitis.
So this
So
is
the
an excellent
Center score
score.
more than 4 is significant. Center
Yeah.
score is more than 4. These children should receive the antibiotic.
So computer G, if we are ready with the correct answer, what is the correct answer? Right, it is scoring system for acute bacterial pharyngitis. And let us see how many of you have given a correct answer. B, 56%.
Okay.
Good. More than 50% is definitely a good. Let us see who is the fastest one. Palak Batra from Indira Gandhi Government Medical College, Maharashtra. Time taken is only 2 seconds again. Wow, great. Winners from all 5 questions, they had given answers within 1 to 2 seconds only. That is excellent. And that also indicates that they are very well versed with the technology and utilizing technology, apart from their actual knowledge with regards to the pediatrics. Good, excellent. Congratulations to the Dr. Palak. Next question. The syndrome caused by Epstein-Barr virus, that is EBV virus, is known as number 1, glandular fever, B, infectious mononucleosis, C, kissing disease, or D, all of the above. Your time starts now. Time's up. So meanwhile, the computer J is being ready with the answer. Your comments, Dr. Sukumaranji.
Okay, this is the answer is all of the above. See, there are various names for Epstein-Barr virus infection. You can classically is infectious mononucleosis. It may be glandular fever, kissing disease. See, usually this Epstein-Barr virus disease is more commonly seen among adolescent college girls. When they kiss the lips, the disease spreads. So it is called a kissing disease. So answer will be all of the above. All of the above. Show the answer.
Yeah, absolutely correct. All of the above. So
Okay.
EB virus, the syndrome is caused, known by its various names, which includes glandular fever, infectious mononucleosis, as well as the kissing disease. So if the graph is ready, computer G, let us see the graph. 100%, excellent.
Correct
100%
answer.
of the individual has given a correct answer. But it is important who is the fastest one, and let us see who is the winner. Again, Palak Batra from Indira Gandhi Government Medical College, only 1 second. So the road is already ready, 1 second, 2 seconds. Great, congratulations. Let us go for the next question, computer G. Which area within India is endemic for Kala Azar? North India, that is Simla and Himalayan belt. B, Western India, Gujarat and Sindh province. C, Southern provinces, Eastern Tamil Nadu. Or D, Eastern part, Bihar, Chhattisgarh and Sundarbans area. Your time starts now.
I
Dr.
think
Keshwan,
Anand is the best person to answer this one.
yeah, that is
Anand
what is
Keshwan.
Dr. Anand Keshwan is sitting quite since a while. So, Dr. Anand, your comments on the question.
Yeah. So yeah, means North
And he
India.
had been to Bihar recently. Yesterday he
Yeah.
was in Bihar.
Yeah. It is mainly in Bihar and Bengal and Sundarban area. It is rightly mentioned. And also, I am the first person to report Kalas in Kerala. That is why I thought that may be the reason. I am the first person to report
Yeah,
Kalas.
you are reported.
India is
Excellent.
like,
See, Anand, one more thing is that now there are a lot of Biharis working in Kerala.
yeah.
Lot of people from Bihar, Bangladesh, and Bengal working in Kerala. So now it is commonly seen in your place. Trichure also we are seeing children with
The
Kalas.
incidence is now dramatically decreased. Now it is not very common as before. Previously, we used to see how many cases. Nowadays, it is not very common. Anyway, the right answer is answer D.
And one more thing I would just wanted to add, apart from this being a right answer, sandfly is the vector for the Kala Azar, and the sandfly is again a vector for the Chandipuram virus, which is right now causing a havoc or panic in not only in Gujarat and Rajasthan, but few of the other states also. So in western part of India, the Chandipuram virus is caused by the same vector which causes the Kala Azar. Yeah, then if computer G, whether graph is ready. Yes, 75% of the participant has given the correct answer. And let us see who is the fastest one. Waiting. Nili Mehta, 1 second, Pramukh Swami Medical College. Again, excellent Nili. 1 second is an excellent way of answering such quiz. Congratulations. Next question, computer G. As per the NTEP 2022, that is National Tuberculosis Eradication Program for Children, which of the following is or are true on INH prophylaxis of the contact? A, all asymptomatic contents below 5 years of age should get prophylaxis regardless of their test, that is X-ray as well as the MT test. All symptomatic contacts should be assessed for TB disease prior to giving the prophylaxis. Or C, all asymptomatic contacts more than 5 years of age should get evaluated first with X-ray chest, Mentux, and IGRA, and then offered the prophylaxis. D is all of the above are true. Your time starts now. We have a past chairperson from respiratory chapter, Dr. Jagdish Chinnappa sir. Your
Yes,
expert
sir.
comment.
Yes, sir. So this guideline, the correct answer is all are true.
Yes. Any further comments from Dr.
Yeah,
Sukum?
see, I was also the chairperson of the
Yeah.
respective chapter.
You are the another. I just wanted to involve the.
Way back in 2000, I was a chairperson. But regarding the NDEP program and also for giving INH prophylaxis, the criteria is all children who comes into contact with a TB case should be investigated first to rule out active disease. Should be investigated for active disease. If
Yes.
active disease is not there, for active disease, at least you must do X-ray. Now, Mando is not never done now. So you must go for an X-ray and CB0 test, and IGRA may be done. And if the child is having no active disease, this child should be given a prophylactic treatment. And prophylactic treatment should be given for all children less than 5 years. Less than 5 years, all children should be given a prophylactic treatment. And regarding the prophylactic drug, there are different regimes are there. The classical example is a 6 months course of INH. But in Kerala, according to the national NTEP program, we are giving 2 drugs. We are giving INH and rifampicin now for 3 months.
Yeah, that is why, because Mando test is no more there in NTP program. And here we are giving INH and rifampicin also. And I don't know whether we have to include HIV test also here. I think we have to investigate. That is mentioned.
HIV test is included only in those suspected for tuberculosis. For that, before starting the anti-tuberculosis therapy, HIV test is must, but not for the screening. And
B.
another important, of course, this answers has been given true, but the another important thing with regards to the INH prophylaxis is it is given only in the non-resistant tuberculosis because if the individual is suffering from the resistant tuberculosis, INH will be of no use.
Yeah.
So for non-resistant cases only, prophylaxis with the INH in the contact.
And also
So
you must supply in B6 also now. B6
Yeah,
has
they
also
supply
recommended.
B6.
Right.
Computer G, which is the correct answer? All are true. And the 81% of our individuals has given a correct answer. And let us see who is fastest among the 81%. Neeli Mehta, again
No.
from Pramukh Swami Medical College, 1 second. Excellent. Excellent, Neeli. You are doing a wonderful job with your laptop and finger along with your knowledge. Excellent. Next question. What is the amoxicillin's duration of therapy for group A streptococcal infection, which is culture proven? A, 14 days, B, 10 days, C, 5 days, or D, 7 days? Your time starts now. Sukumaranji, any comments from your side?
Yeah, the correct answer should be 10 days. See, the streptococcal sore throat tonsillitis, they must give the drugs for 10 days to prevent later complications like rheumatic fever and acute nephritis. Should be 10 days. The first drug is amoxicillin. And other drugs are not very much indicated. If the child is not responding, the second line may be amoxiclav. And in severe infection, you may give a ceftriaxone. But usually we give, all children are getting azithromycin. But azithromycin is not a good antibiotic for treatment of streptococcal infection. And the only indication for giving azithromycin is that those children who are allergic to penicillin or amoxicillin, you may give azithromycin. So the correct answer is 10 days.
I
So the
think
correct
it's
answer?
very wrong practice to give you have to 5 2 days, 7 days antibiotic like that. So we have to give 10 days antibiotic.
So remember here, it is 10 days is must. Computer Ji, the correct answer is 10 days. And let us see how many of you have given a correct answer.
Only
10 days
14.
means D.
Oh, only
Only
14%.
14%.
Only 14%.
14%.
So majority of us are of the opinion of
10
giving
days.
for 14 days rather than for 10 days. And the fastest one is Dimple Shah, again from Pramukh Swami Medical College. 3 seconds. Congratulations, Dimple. The next question.
Why there is that much of confusion regarding the answer? Because many of them answered 14 days. So I think it's a very wrong impression for them. And some of them answered 5 to 7 days also. Agnes, sir?
Yeah. So we continue with the, or we want to change anything, sir?
No, I think we will start. I will start. The next 5 questions I will start, then Anand can follow
Okay,
that.
sir. Please proceed, sir.
Okay, 10 questions. 10th one. Computer Ji. Next question. Which subspecies of mycobacterium is used for BCG vaccine? A is Mycobacterium chelonae, Mycobacterium bovis, Mycobacterium africanum, and Mycobacterium canete. Your time starts now. Please show the correct answer. So the correct answer is Mycobacterium bovis. And BCG vaccine is always called Bacillus calmette-guerin, and is a bovine strain of Mycobacterium and not a human strain. And you know, BCG vaccine can produce some of the complications like BCG adenitis, for which no mycobacteria, no anti-TB treatment is required. The correct answer is Mycobacterium bovis. It is a bovine strain of BCG. Show the graph.
100%, I think.
It will be 100%. It's a simple question.
Sir, after this, we'll show halfway through leader,
Okay.
how they are faring, sir. Then before we go to the 11th one. So is the graph ready?
Be 100%.
58%, yeah.
Oh, it is only 58%. Oh, unfortunate. So I think, madam, you must, you can go to the marks now, total marks.
Anyway, let
the
us see
ranking.
who is the
Who
fastest
is a
one in-
winner?
Yeah,
Winner.
who is the winner, please. It should be in 1 minute time. Oh, 1 second, 1 second.
1 second, Nili Mehta again.
Nili
Wait.
Mehta. Okay. Show the winners now. The marks, total marks.
So friends, we are almost halfway through the
Yeah.
quiz and the let us see what is the status of winners at present. Still there is a time. So this is to motivate others, not to demotivate others. This is to motivate others to move fast with their correct answer.
Oh,
Nili
fantastic.
Mehta,
Nili Mehta
50%.
5, Palak Batra 2, Dimple Shah 1, and Vedanti 1, and Vijay 1. Oh, congratulations to all the 5 people. Neeli is leading now. I think we will go to the.
Another curious thing, Dr. Sukumaran, all ladies.
Yeah?
Again, ladies' power.
Okay. Okay. It is all ladies. Oh, okay. We'll go to the next question. Question number 11. Question number 11. What kind of infections are common in children with chronic granulomatous disease microbiologically? The answers are oxidase positive organism, oxidase negative organism, catalase positive organism, and mycobacterial infection. Time starts now. So this question is regarding chronic granulomatous disease. Chronic granulomatous disease, as you know, is an immunodeficiency disease. And the main problem in CGD is a defect in the phagocytosis of the neutrophils. There's a phagocytic defect, and the main defect is in the phagocyte NAPH oxidase enzyme. So it is deficient in these children, and so there's a high incidence of catalase positive organism and mycobacterial infections in children with CGD. And usually the CGD presents with multiple abscesses in the liver, lung, spleen, etc. So the correct answer may be D. D is the correct answer. And the CGD is always called Bridge-Good syndrome. It's another name, Bridge-Good syndrome. And so it is a phagocytic defect. Now let us see the graph. Is graph ready? Oh, I think the 66% has given the correct answer. Who is the winner? Again, it is Naresh from Gujarat. Congratulations, Dr. Naresh. We will go to the next question. Question number 12. Varicella virus is a DNA-based virus belonging to the herpes family group. RNA-based virus belong to herpes virus family. DNA-based virus belong to the arbovirus family. And these RNA-based virus belong to arbovirus family. Your time starts now. So the correct answer will be DNA-based virus belong to the herpes virus group. It's not RNA, it's a DNA-based virus. As you know, vaccine is available now. And the arbovirus usually produce an encephalitis syndrome, mainly. Anand, any comments?
No, sir. We say now effective vaccines available and they mainly affect the brain in the cerebellum and other area. So we'll get ataxia is one of the common feature, and very effective vaccines available now.
Is the graph available now? Show the graph. Jagadish, any comments? Jagadish?
No, I think it is one of the few DNA viruses, the other being molluscum contagiosum. So it's an unusual kind of herpesvirus DNA-based virus infection.
Please show the graph. So the correct answer is given by 61%. Who is the winner? Is again Navami from Baroda Medical College, Gujarat. Congratulations, Navami, for the excellent performance. Yes, answer is in 1 second. Computer ji, next question. Question number 13. Which essential micronutrient that depleted through diarrhea and needs replacement? A is zinc, B is magnesium, C is calcium, D is copper and iron. Your time starts now. So the answer? So answer is again zinc. Zinc is a micronutrient that is lost in diarrhea. And the recent WHO recommendation is to give zinc supplementation in all children with diarrhea. The dose of zinc is those children less than 6 months, you must give 10 milligram. And above 6 months, you must give 20 milligram of elemental zinc for a minimum of 14 days. And either you can give a zinc sulfate, zinc carbonate, or zinc gluconate. Any of the zinc preparations can be given. It is zinc alone, and zinc should not be combined with B-complex vitamins or iron. Zinc alone for 14 days. And it is found that zinc can reduce the frequency of diarrhea, and zinc can reduce the recurrence of diarrhea in children. So the correct answer is zinc. For the answer?
The government is promoting this as a Jodi number 1, zinc with ORS.
Yeah.
And our ORS day is coming up. Now weekend ORS day and week is coming up. And
It's coming up.
Next Monday.
Next week.
Computer ji, please show the graph. Again,
64%.
The correct answer is given only for 64%, should be 100%. Because actually the drug of choice for diarrhea should be zinc and not antibiotics. Who is the winner? Again, Vijaya Ruke from Nagpur. Congratulations, Dr. Vijay. And he has answered within 1 second. Next question. which of the following antibiotics are also known for their antitoxin effect? For their antitoxin effect, A is amikacin with azithromycin. B is clarithromycin and clindamycin. C is lingomycin and linezolid. D is clindamycin and linezolid. Your time starts now. So the probable answer may be clindamycin and linezolid. Now we are seeing a lot of children with a necrotizing pneumonia with empyema. I think it should be the drug of choice should be clindamycin and linezolid. It has an antitoxin effect also. Yes, Jagadish, any opinion, comments?
Important thing is, especially while treating toxigenic organism like Staphylococcus aureus, which is a toxin-producing organism, it is very important to neutralize the toxin. And for that, the drugs of choice are clindamycin and linezolid. The problem with clindamycin is again the development of resistance during treatment. And the problem with linezolid is that it has significant side effects. And second issue is that it needs to be reserved for treatment of drug-resistant tuberculosis. So I think the important thing is clindamycin and linezolid both have antitoxin effects and primarily used in practice against the toxin of the Staphylococcus aureus.
Both these drugs can produce some of the complications, like clindamycin can produce pseudomembranous enterocolitis. And linezolid can also produce thrombocytopenia also. Thrombocytopenia with linezolid. So you must be very careful.
So non-responding empyema, they are the drug of choice, especially for non-responding empyema.
Hepatology, please show the graph. Correct answer. Correct answer is clindamycin and linezolid. Please show the graph.
Only 15%.
Only 15% gives a correct answer. Yes. Who is the winner?
Navami.
Navami. Yes. Again, 1 second. Congratulations for Navami. I think from question number 15, I think Anand can take up. Anand, please take up. Next question.
So, which antitubercular agent is known for causing retrobulbar neuritis? So, all activities with some complication, but which is more commonly associated with retrobulbar neuritis? A. Isoniazid, B. Rifampicin, C. Pyrazinamide, D. Ethambutol. So, answer please.
Your time starts now.
Time start.
The main problem produced by isoniazid is peripheral neuropathy and hepatotoxicity. So you must you have to supplement B6. Rifampicin is again hepatotoxic and it can produce a flu-like syndrome. Pyrazinamide again is hepatotoxic and it can produce hyperuricemia and secondary gout. So the answer would be ethambutol. Ethambutol can produce retrobulbar neuritis. And I think retrobulbar neuritis is not very common in children. And in all regimes, we give 2-HRZE followed by 4-HRE. So the correct answer is ethambutol.
So, right answer is ethambutol. Previously, we thought it is very common. That is why ethambutol is not included in continuous regime. Now it is there both in intensive and continuous regime. It is not toxic, especially when we are giving pyridoxine. It is very effective to prevent all types of neuritis due to isoniazid or ethambutol. So the right answer is ethambutol. Computer G. So very happy to say that 85% of people are given right answer. Only 15% opt for other answer. So who is the winner? The Yuvanshi Patel, again from Pramod Swami Medical College, Gujarat. Congratulations. And she answered within 1 second. Congratulations. Next one. So in leptospirosis, how CNS manifestation occurs? So question answer 1, high burden of spirochetes in the blood. Second one is penetration of the spirochetes in the CSF. C, immune mediated mechanism. D, all of the above. So which one is the best? Your time starts now. So Agnesh ji, any comments?
This leptospirosis, of course, is not common in the Gujarat area, but still we come across some of the patient in Gujarat area. So there are various issues with regards to the leptospirosis. The CNS manifestation is the fatal one, and the immune-mediated mechanisms could be the responsible for this. Penetration of spirochetes and CSF is not that particular. Probably that we are not commonly seeing this case in the Gujarat.
Leptospirosis is very common in Kerala. We see a lot of children with leptospirosis. And now the main problem is common cause of death is other than encephalitis, these children will develop myocarditis. Myocarditis and pneumonia is very common in these children. And a safe drug is there. All children should be given doxycycline, and doxycycline prophylaxis is given for those workers who is working with polluted water. Yes, show the graph now. Show the correct answer. So it is immune-mediated mechanism. Please show the graph.
Only 14%.
Oh, correct answer is given by 14%.
Yeah, I think some confusion may be there because it may be blood spread also. So CNS manifestation may be to immune mediated. That may be the confusion here.
Yes, who's the winner? Again, Vijay. Vijay from Nagpur. Congratulations, Dr. Vijay. We'll go to the 17th question.
Yes, Dr. Anand.
So next question is 17th. What is the drug of choice for congenital cytomegalovirus infection in those with no clinical issues in GE absorption in a hemodynamically stable children? So question choice number 1 is oral 1-ganciclovir, and B is IV ganciclovir. Third one is IV Foscarnet, and last one is IV acyclovir. So your time start now.
Okay. Show the correct answer. Again, the correct answer is oral ganciclovir. And the question is if the GIT is normal. The question, there's a clue is there with no clinical issues in GI absorption. If GI absorption is normal, they can be treated with oral 1-ganciclovir. Yes, Anand.
Because all that gave some clue, all are other IV drugs. So clue is that orally absorption is better. So they can IV. So it is a question itself, answer itself showing some answer.
No, it is a clue, but any smart persons can catch it because 3 are IV and only 1 is oral, but it is uniform. I think you please take a call. Yeah,
Clue is for everybody. Clue is for everybody.
yeah.
Okay.
Thank you.
So the correct answer is A. Okay. Computer ji, show the score, show the graph.
Okay.
72%.
Yeah, then also only 72% I answered very well. I think they are not reading question very carefully. That may be one reason.
No, but there's no time to read the question carefully. The time will be gone. If you look at the question, then they will lose the time. So it will be answered as quickly as possible. It's not the usual MCQ questions, but time is more important in this quiz program. Who is the winner?
Yeah.
Oh, new winner has come.
This
Sadi
is-
Kamini.
Only female students are there, no male students.
Jagadish said only females now.
It may be due to Manjula madam is leading the quiz. That may be the reason.
Anandji, just check whether the all male participants are in a position to join or not. They are kind of joining.
No.
Computer ji, next question.
Which of the following is true regarding dengue fever? Now it is very dengue season. I think everybody should answer this one. There is an approved vaccine for preventing dengue in India. Dengue virus transmitted by a curious species of mosquito. Production of IgM starts on the day 2 of illness. NS1 is rapidly cleared in secondary dengue infection. So your time starts now. Kumar sir.
Yeah. Show the correct answer. The correct answer is, I think it is D. NS1 is rapidly cleared in secondary dengue infection. In dengue infections, we look for three antibodies. One is NS1, then IgM and IgG. NS1 is the first one to appear. Even day one, NS1 is there, but it will be rapidly removed from the body. And the IgM usually develops by the fifth day, and IgG by 15th day. I think the answer is D. Please show the answer. Answer is D. Okay. But you must not go for all these antibodies. Demonstration is not very important. It's a clinical diagnosis. You say it is a clinical dengue and non-clinical. Even the antibodies are not you can make a diagnosis of a clinical dengue and a complicated dengue. Please show the graph now.
Oh,
50%.
50%. Very
Yeah.
good. Who is the winner now?
Shyam Kumar Das, within 2 seconds.
Yeah. He's from Gandhinagar. Yes. Congratulations, Sayan Kumar Das.
So
Well
new
done.
winners are emerging.
Yeah. Yeah. True. If new winners are coming up, I think there will be easy win for those who get highest rank. Next question.
Next question.
Anand.
So what is the drug and duration of anti-malarial therapy to prevent recurrence? So Primakin for 5 days, chloroquine for 7 days, Primakin for 14 days, chloroquine for 14 days. So your time starts now. So we can know that the chloroquine is not effective to prevent a recurrence, so it is Primakin. So Primakin you have to give for 14 days. So we'll wait for the right answer. So right
Yognesh,
answer.
any comment?
Yeah.
Yognesh?
Yes, Agnes mentioned malaria is not common in our area.
No. Malaria, of course, is common in our area. Kala-azar is not that common, or leptospira is not common. Primaquine is definitely a drug of choice for P5X malarias because of liver involvement. This is second cycle of generation. So we should give it for minimum 14 days when we are giving a prevention of recurrence. And it should be given whenever you had a confirmed case. It should be definitely given.
Computer ji, please show the graph now.
Yeah, graph.
Can we have the graph?
Ma'am, 1 minute, ma'am.
So 71% is right answer. It is, I think, a very good response. Now, who's the winner for this question? 19. Vijay Aroge. I think new fellows are coming. Very happy to see that many people are.
He is
But
already
He has already answered
Yeah.
couple of times.
Vijay Aroge answered. Yeah.
Okay, I think we will go for the last question, no? Question
Yeah.
number 20.
Yeah.
Last question I opted for my teacher, Dr. T.J. Sukuman, sir.
Okay. Which of the following is not a macrolide antibiotic? A is azithromycin, clindamycin, erythromycin, erythromycin. Your time starts now. Okay. The correct answer most probably is clindamycin. Clindamycin is not a macrolide. But regarding azithromycin, erythromycin, erythromycin, if you read the pharmacology book correctly, they say that azithromycin is not a true macrolide. It is an acylide. It is an acylide. But usually we say the macrolides are erythromycin, azithromycin, and erythromycin. So the correct answer should be clindamycin.
Roxithromycin is no more available, sir. Roxithromycin is also another member.
Now there are a lot of newer drugs
Sir.
are there, newer macrolides are there. Show the graph now.
So 2 seconds, ma'am.
%88%.
Oh, very good.
Good.
Who is the winner?
Navami. Good.
Navami S. from Gujarat. Now I think, madam, 20 questions are over.
20 over, sir. We should
is the
wait
score
for
now?
the score. They'll come back and we should see whether any tie has happened or do we have the clear winners. So, any guesses, sir? Tie or Jagdish, sir?
No
Tie?
tie. There won't be a tie because
I think the
first and second
first
will be a
position
clear
is
winner.
clear, but the second position
Second
I
is
don't
also
know.
clear.
Yeah.
First
and
there's
second
no
both clear.
problem.
Both
Good
are
evening,
clear.
Anand Vasudevan, sir.
Hello, good evening, good evening.
Yes.
Good evening, everyone.
Yes.
Yes, good evening, sir.
Good evening. Good evening.
Good evening, sir.
So they're calculating. So
So the quiz went
Yeah.
on very well. There was no
So-
confusion in the questions.
correct. So I think there will not be tie. That's what they're saying. So let them. if they are ready. So we have two clear winners, but the difference is not much between one. They're going to say so now. So can we have the table showing the scoring for 20 all questions? Sudarshan sir, if you have any comments now, when they're compiling anything.
No, nothing. Only my internet is very unstable. I may
Should
get disconnected. That's all.
because of
Otherwise,
rain,
it
I
will,
think.
yeah. Otherwise, it is all very fine and smooth, well conducted. We'll see the result. And please count whether 20 correct answers are there.
Yes. Right.
20 vertical.
They require
Only
another.
one
Yes, sir.
question provided for 5 answers. All are 4 answers. One question provided 5 answers. So
But
try to make it uniform. One question up to A, B, C, D, E. One
Yeah.
question. And another thing is that IV uses such a controversial, it's not controversial, but such a question you can avoid. That's my comment.
So we have clear verdict. Neeli Mehta, 5 correct answers. Vijaya with 4 correct answers. So both are the winner and the runners up for the today's quiz. So we do not have a tie now. So we can have a final verdict from the our end. Over to Dr. Sukumaran, whether you want to have any comments.
Oh, just a fantastic show. Even by the students also, they have done very well. But this Neeli Mehta and Vijay will be contesting for the finals along with the fever conference. I think they should prepare very well, and the questions will be more tough in the final rounds. I wish all the winners and all participants all the best. And I also thank Madam for giving this opportunity. Thank you, Dr. Manjula.
Thank you very much. Thank you.
Thank you. Yeah.
Thank you, sir. Thank you very much.
Jagdish sir, anything you want to say, sir, before
No,
we?
I think it was very well conducted. Congratulations to the 3 quiz masters today.
Yeah.
Congratulations to Dr. Neeli and Dr. Vijaya for doing so well, and also to all the participants. I think today was the biggest spread of winners.
Yes,
Large
sir.
number of them, but
And majority of them answered within 1 second or 2 seconds. That is another achievement for the day.
Correct.
No, there is a trick there.
Yes,
First
sir.
press, then you think over the answer.
Right, sir. So thank you very much to all our faculty, quiz host Dr. Jagdish Channappa sir, and quiz master Dr. Professor Sukumaran sir, Professor Anand Keshwan sir, and Dr. Yagnesh Popat sir, and Professor Sudarshan sir for being the jury. And thank you all very much. And I congratulate the winners, Dr. Neeli Mehta and Vijay. Okay, so congratulations. So both of you will be competing for the national championship in November at FEFCON. Fever Foundation team will contact you and give you all the details. And I also congratulate all the participants who took part in this and played a very nice game of Fever Quiz. It has both fun as well as the educational aspect of it. That was the aim of this quiz. And all of you who has participated today will get a certificate of participation from the Fever Foundation. And please do submit your posters for a poster competition. Last day is September 10th. So with this, with the permission of our quiz host and the jury
Tomorrow,
and
madam?
quiz
Tomorrow,
members, so tomorrow is north, sir, north zone, sir. Tomorrow.
I'll be there, madam. Tomorrow I'll be there.
You'll
Now
be
you're
there.
free.
Okay, please come, sir. So, congratulations to all of you, and thank you, digital team, Deepika and Atharva and Praveen, Mr. Jairaj, sir. Sir, would you say anything before parting?
No,
Sir?
I mean, I'm sure it's a great event, and I really thank the Fever Foundation and advisory board members and the panelists of the quiz, and more so the participants who have enthusiastically participated in the quiz, and looking forward to seeing the finalists in our FEFCON final quiz
sir.
That's in November. Thank you very much. Thank you all.
Thank you. Thank you, everyone. Namaste.
Thank you. Thank you.
Namaste. Namaste. Thank you, RX Events.
Recording stopped.